I'm going to start by introducing our speakers. The way it'll go is first we have the speaker session in which we are going to invite folks from organization who are doing amazing work for the international medical graduates in various capacities, dedicating the time. Then we will talk about some IMG resources, and then we'll jump into introduction of the 3 program directors, and then a panelist discussion after that. So I would like first to invite Dr. Ricardo Carrea. He's a program director at of Endocrinology, Diabetes, and Metabolism Fellowship at University of Arizona College of Medicine in Phoenix. He's also Director of Health Equity and Inclusive Initiative at the Endocrinology and Metabolism Institute at the Cleveland Clinic. And he's also the Health Equity Fellowship Director at Creighton University School of Medicine at Phoenix. And he is also the chair of the IMGs Governing Council for 2022 and 2023 for the AMA, American Medical Association. And I don't know how you find time to join us, but Dr. Carrea, thank you so much and amazing work that you're doing. So the floor is yours.
Oh, thank you so much, Dr. Sahgal. Sorry that I'm in my car. I'm just returning from an event that we have in Phoenix with the AAMC and the Mayo Clinic about specifically about something related to IMG. So my talk was how can we include IMGs as minorities in medicine? So we are not only, like, we know that underrepresented minorities are not, IMGs are not included. And I was trying to talk and convince the people there that IMGs are minorities, so we can be included as that. So I'm just returning. So I'm in my car, but I'm stationed in Cleveland Clinic since 1 month ago. I still have my relationship and my focus on doing some things in Phoenix, but my main job, yes, is now the program director for the fellowship in the Cleveland Clinic and the health equity director for the institute. So thank you. It's a real pleasure to be here, and I really appreciate your invitation and the invitation of Dr. Mehta for all the hard work that the Medical Society of New York has been doing on this area. So I will be very brief and try to explain a little bit of what the American Medical Association has been doing in the last years regarding moving the needle on making IMGs part of the have a voice in the House of Medicine. So first of all, there 2 years ago we launched the Diversity, Equity, and Inclusion Survey to understand what was the main microaggressions and main macroaggressions and unconscious bias that IMG suffer. Everybody always was assuming that we are in the same boat as the rest. And there we found different things. We found that many of our people are discriminated by the country of origin. They are discriminated by accent. The well-being is less in many cases because they are abused, and sometimes they feel because they are in a visa they cannot say anything. So all of this data realize that all of the things that we know, this is not something new for us, but it's something new for the rest that are not IMGs. So all of this, we're putting it together, and then it will come in a report to the Board of Trustees of the AMA, and it will come in a publication. So everybody is aware what is the difference between when you have to focus on DEI for US medical graduates and when you have to focus on DEI for IMGs, that there are things that are not in common for both. There are things that are common for both, but there are things that they are not common for both. So that's one of the key issues that we are working this year. The other key issue that we are working is trying to promote policies that standardize things like that happens in for everybody in the House of Medicine, but that affects more us. So what is going to happen, or if this is going to affect the USMLE step 1 pass and fail into more to IMGs or not. So they were requesting a study on that kind of things. Specifically, 2 policies that we passed in the June meeting was about the Ukrainian and Russian applicants or IMGs that were here in the US on how the way of confirming their medical school and all of that when this is very difficult in a setting of a war. So that's something that now the Board of Trustees and the Council of Medical Education will come to us and report on how they are going to do it. So in November meeting, we will have a little bit more updates. Besides the policy and the issue of DEI, we are very involved on trying to get more IMGs involved in at the level of the AMA. And I know that in the Medical Society of New York, there is a strong IMG section, and we want to bring that strong IMG section to the AMA because at the end, the AMA is the one that have the most powerful input at the level of the federal government. And if we want to make some changes at the level of the federal government, and we want to make some policies on things in Washington, D.C., we need as many representation. So we need that the AMA knows that we represent 25%. We are tired of telling them that as an IMG, we represent 25% of the physician workforce. But when they look at the numbers of members, we are not at 25% of their members. So that is something that it's against us, and we want to bring that part together. And definitely we continue our collaboration with the ECPMG in moving certain things. One of the main issues is, as all of you were aware, the ECPMG 2024 program, where in 2024, they will start in only recognizing students that come from their recognized universities, and this will affect it. This was going to affect a big part of the IMGs, approximately 70% of the IMGs that come to the US, especially from Pakistan and India. So thanks to the collaboration of the IMG section, and especially thanks to Dr. Pandya from Virginia, there was a big movement on talking with the Embassy of India in the US and with the ECPMG. And now the ECPMG in the last board of director meeting decided to postpone that 2024 day to later. So it's not postponed forever, it's on hold, but right now we know that the discussions and conversation with the Council of Medical Education in India has been advancing very well, and they are starting the process of accreditation. So this is a good sign. So probably not by 2024, but later on. So that's something that has been advancing. And finally, I think that something that we need to continue fighting at every single level in our institution and at the national level is making sure that the programs director knows what an IMG is and are not afraid of taking visa applicants because they think that something bad will happen with the visa applicants. So in our states levels and our federal levels, we should make aware. I am doing the work at the level of the programs director of endocrinology and internal medicine, but we need a lot more effort in all of the programs director, because many times I hear this, oh, that person is very good, but it's in a J1 visa. I don't know how to do that. So thank you so much for the time. And I hope that if you need more information, Dr. Parag, Mehta, and myself, we're more than happy to tell you.
Thank you, Dr. Carrea. Thank you. Appreciate it. And I can see the passion in your voice, and I think every speaker is very passionate. So just for future speakers, being a little cognizant of the time, I just want to introduce now Dr. Parag Mehta, without whom these series would not be possible. Dr. Mehta is president of Medical State Society of New York. He's also delegate of MSSNY to AMA. He's a governor class of 2022 in New York ACP section, Queens, Brooklyn, Staten Island. He's a physician wellness champion. And he also is the vice chairman of Department of Medicine in New York Presbyterian Methodist Hospital, as well as the chief medical information officer and interim chief medical officer and chief quality officer. I'm sorry, Parag, I messed up. You're the CMIO, the interim chief medical officer and chief quality officer, and I don't know how you get time to sleep. So thank you, Parag. Floor's yours.
So thank you so much. And the biggest thing which you missed in my introduction is very simple, that I'm an international medical graduate, I'm an IMG, and I'm proud of it. I have never forgotten the days when I came in here as an IMG, and that is the reason we are here together to help all of you to understand the system. I know all of you who are here and not here, international medical graduates, are extremely talented, and you should get what you deserve. And that is where, if you understand what a program director is looking for you, it will definitely make a significant change. That was the first program, that how to write your personal statement. That is out of your way. We are going to have today how to give your input. I see that all the speaker panel is here. I will yield my time to all of them. Again, you can reach me anytime. My name, Dr. Parag Mehta at Gmail. That's my email. You can reach out to the president at MSSNY.org. Everything what we are going to discuss will be summarized by Sandy Bennett and the staff. I really want to say thank you to Sumir, the entire team of MSSNY, and the partnership with all the ethnic organizations, NYACP. I can go on. For the sake of time, I'll say that please look at the MSSNY website and MSSNY Pulse, which is an app. You will have all the presentations and everything keep coming up. Attend the future programs, including one which is coming on 25th by Sanjeev Chopra, to see and listen how to tell your story. Even though he's going to give a round on to some different subjects, you will understand. And one thing which I'll just finish with is that if at all I have one advice to all of you, I'm asking you to practice right now, and that is a smile. No matter what question is going to be asked, one answer has to be there, is your smile. You need to show your presence, passion, confidence, and enthusiasm. But practice, practice, and practice. Smile, smile, and smile. Practice to speak little slow and loud and clear. With that, I'll give back to the next speaker. Thank you.
Thank you, Parag. And Dr. Mehta is very humble, and he has done so much for the international medical graduates. And I think he'll always remain a resident the way he speaks in his heart. And I do want to also recognize the MSSNY staff, Sandra Bennett, Michael Reyes, and Mr. Troy Oshner, who have spent countless hours in organizing this before, during, and after this IMG seminar. An amazing team of MSSNY who's supporting us in our mission to help you. Our next speaker is actually Dr. Emmanuel Francois. He's a general surgeon in New Jersey. He received his medical degree from University of Haiti. He's also the chairman of the board of trustees for AMHE and a founding member of the AMHE. And he is filling in for Dr. Carl Lototu, who has some disruption in travel plan. And there's been a conference in Madrid, and due to which one of our two speakers were not able to make it to this conference. So Dr. Francois, floor is yours.
Thank you very much, and thank you for the invitation. And of course, I was not letting the subject, only I have the feeling, but I am so glad to be here because this is exactly one of my biggest passions since I've been here. I am a graduate from the University of Haiti, entered the United States in 1966, went to the service as a U.S. Army major in Vietnam, and shortly after Vietnam, still resident at Columbia University in surgery, we created the Haitian Medical Association. This is probably one of the first ethnic medical association in this country. And we just celebrated our 50th anniversary last July, and we had been marching on since then. the subject of FMGs had been very close to our heart. We literally helped create the FMG section of the AMA when we had our own delegate there, Dr. Michael Rigo, that is still alive, fortunately for us. And presently, we are represented into that section by Dr. Louis-Joseph Auguste, who is also board member of our organization. Of course, we all know the plight of the FMGs, and for anything, I would tell everybody I had survived all of the negative that they want to put on the FMGs, and the road may be difficult, but it's not impossible. And I'm there really very much glad to add to my own experience to whatever we'll be talking about. And I know that you do have a need for time, and I would not let me go and then avoid into my defect of speaking for a whole time. Thank you very much.
Dr. Francois, thank you so much, first for joining at such a short notice, two, for channeling your passion to organize the Haitian Medical Association abroad. Of course, it's the English version of the French AMHE. We really appreciate all that we are doing, and hundreds of IMGs on this call really appreciate the work you're doing and the legacy you're creating.
Okay, thank you.
So thank you so much. Really appreciate it. Our next speaker, Dr. Goris, most likely was not able to join due to travel disruption. So I'll ask Dr. Alfred Leong to join us here. Dr. Leong is a board certified internist in New York. He's assistant chief of medicine in New York Presbyterian Brooklyn Hospital. He's assistant professor of clinical medicine at Weill Medical College of Cornell University. He's also vice president of the Myanmar American Medical Education Society, called MIMS. And Dr. Leong, I am of the old school. That's when Myanmar, I still remember being called Burma. And we have such amazing physicians from this country in this, including in our group. So thank you for joining us. And thank you for all that you're doing under the MSSNY Committee for the IMGs.
Thank you, Dr. Sahgal. And I want to say special thanks to all the leadership of the organization from MSSNY, MSCK, and also ACP, and all the other ending organizations. Special thanks to Dr. Mehta. She's a pioneer that organizing all these things and give a lot of suggestions, guiding everybody how to make it happen. So I'm a vice president of Myanmar Medical Education Society. So yeah, we usually have every year we have our own resident guidance. But this year, thanks to MSSNY and MSCK, we try to do it together. So that's why we try to invite all our membership. And also, I also want to thanks to all the MEMES leadership also for helping us to make that happen. So I just want to make just a very, very brief summary, a suggestion for all the IMG. So all the IMG, they have two things. One thing is they graduate from the international graduate. So some of the things you cannot change it, like your school, the way you train, the way you're coming from which medical school. But some of the things you could definitely change to improve your chance of getting into the residency in this country. So I will just make it short because the program director will tell you more in detail. So my short suggestion is, number one, try to learn how to dress up, how to improve the communication, and also try to prepare during the interview. The main thing, you have to prepare how to sell yourself, how to tell to the program director that you are the fit person to get into the program. So during the interview, make sure you have a good communication, make sure you're friendly, make sure you're smiling, make sure you have a good gesture, make sure you are a good teamwork, and also always willing to help other people. So don't be shy. So that's very important. And also, like Dr. Mehta said, practice, practice. This is very important. You should practice with your friend, your other physician. It's kind of mock interview you should do at least 2 or 3 times before you go to a real interview. And also one of the reminders, I've seen many of those IMG write down all these research and experience this and that. But when you come to ask them, sometimes they're not able to answer. So be prepared how to present your research or activity that you have done. You put it in your CV. So I like to say good luck to everybody. So yeah, that's my short, yeah. Okay,
Thank you, Dr. Leon. I appreciate the amazing insights you're providing and your continued participation in our committee. The next session is something we added this time, is resources for international medical graduates. We have folks who work tirelessly and would like to talk about it. I would like to introduce Dr. Jitendra Barmecha. He likes to be called himself as PGY26. He's a poor IMG like many of you from the past, but he's done so well that he now stands at the head of all the physician leaders. He's an attending in the Department of Internal Medicine at St. Barnabas, but he's also Senior Vice President, Chief Information and Digital Strategy Officer at SBH Health System. And currently, he is the president of the New York American College of Physicians. So floor is yours, Dr. Barmecha.
Hi, good morning, everyone, and thank you, Dr. Sahgal, and everyone who is on the podium along with me for sharing our stories and what incredible work you all have been doing. So again, I was in this boat February 7th, 1996. I came in for interview, so I understand what you all are going through. So I will split my next 2 minutes or 2.5 minutes into what American College of Physicians resources are there for IMG. So first of all, it is one of the largest professional organization for internal medicine and specialties. We span over more than 125 countries. So you may or may not have heard in your own country regarding the presence of ACP or American College of Physicians. And each state has its own chapter with the leadership. And what we call it is as a professional home. So you have your own home where you live, but your professional home, if you have passion for internal medicine, this is your professional home. Beyond the clinical guidelines, formulations, and educational opportunities, there are immense opportunities for physician advocacy, also for networking. You have regional conferences or networking events. Those who are from New York, on November 4th and 5th, we have our annual scientific session. And there is a workshop on the POCUS, what is the point of care ultrasound. So again, apart from educational opportunities, they are also enhancing your procedural and activities as well. Also, if you are doing some scholarly activities or research, there are several opportunities for you to publish. And regarding the IMG, there is a nominal fee. I think it's about $49 per year, but you get access to almost everything what those who are residents or fellows or the attending physicians are. So the website is straightforward, acponline.org. And in particular, if you are from New York, please look at nyacp.org as well. And regarding the interview, I think everybody mentioned, I would recommend few things that come at least 5 or 10 minutes early so that you are not in haste. Whatever you have written down in ERAS or your CV, please make sure that you can articulate extremely well. Even if you have done your observership or any clinical experience, you have to be very honest what you have done. And I used to do the interviews for the residents, and you can see through the eyes if you have created any stories, if you are not true to yourself. So the most important thing is, see, because of your good scores, you are already on the interview room. That means you have done incredibly well. You have come all the way if you are doing an in-person interview. So Please memorize your entire ERAS application. Just be comfortable. And as Dr. Leong mentioned, you have to sell yourself. You are competing with thousands and thousands of other IMGs, but I'm sure each one of you will definitely deserve a seat at the residency program, and I'm sure you will get it. So good luck, and I leave the floor to other incredible speakers who are here, and I'm also going to learn from them today. So thank you, Dr. Sahgal.
Thank you, Dr. Barmecha. Dr. Barmecha and I work in the Bronx, so we share not only the same similar area of working, but also very similar passions. And Dr. Barmecha and Dr. Parag have organized a diversity event under API on November 4. And congratulations for such amazing event in advance. Next, from the IMG sources is somebody who actually works and lives his passion day and night. His name is Dr. Victor Sebastian Arruarana, commonly known as Sebas. He's an international medical graduate from Argentina who not only pursued his medical training, who's not only pursuing his medical training as OBGYN resident at Lincoln Hospital, but also has transformed his lesson from life journey into help others through Project IMG by organizing events, giving advice, and meetings to hundreds, if not thousands, of IMGs. Floor is yours, Tavas.
Hello, Dr. Sahgal. Thank you for the introduction, and nice to see everyone here. Right now I'm in Chicago because we just did a meetup yesterday for a lot of IMGs here in the Chicago chapter. And I just wanted to mention what we are doing in Project IMG and the IMG event. So for those that don't know, one of the things that I created is Project IMG to help IMGs from all over the world. We have more than 1,000 ambassadors in every university, and we are in campus also, not just in the US, but in almost every school around the globe. And if you want to be part of this, you can have leadership positions and have access to everything in our platform. What do we offer in our platform? It's a free platform that we have more than 300 video lectures, research courses. We have the Research Society, where, of course, due to HIPAA regulations, we can give you personal hospital data, but what we work the most is on literature reviews, meta-analysis. So you guys, in your home country, you can also get publications going. And also we created now the Project IMG network, which is like a LinkedIn or Facebook, but just for IMGs. And we also have, we still haven't done the official launch. We started this around like 1 month ago, this network, and we already have more than 15,000 members just there chatting and connecting with each other. I don't want to go much because there's too much to talk about and not much time. And also, I want to mention the IMG event that I'm organizing. Is the first one was last year in Central Park. In like 3 weeks, we got more than 400 IMGs. The second one was this year. Dr. Sahgal was here. Dr. Barmecha was here. Dr. Ricardo Carrea was also gonna be one of the speakers. We had around like 1,000 IMGs. The goal is next year also USMLE themselves are probably coming among other big organizations, and we're expecting maybe up to 2,000 IMGs next event in New York. And we also do events all over the globe and different states in the US. For example, this one that we're doing in Chicago. We recently had one in India. We're planning one in Karachi, Pakistan. So there is, resources for everyone. And regarding interview season, I just want to mention, yes, Dr. Barmecha said, be yourself is one important trace that you can be there. And also one phrase I wanted to say that is, to get to places that you've never been, you have to do things that you have never done. And sometimes, you feel uncomfortable of doing new things or taking the risks, but, never be comfortable. Always, aim for to be uncomfortable and to continue working to your goals. Because once you are comfortable, that means, life gets very basic and miserable. You should always continue and working towards that. And if anyone wants to see a network, you can go to projectimg.com, and there is one page, an option there to join the network, and you can look for us on Instagram at Project IMG. Okay, guys, I don't want to go too far.
Thank you, Sebas. And, I can only think is when life gives a lemon, make a lemonade. And you have truly demonstrated an amazing passion and life journey, putting yourself through yourself by medical school and then coming to this country. So I think people can learn a lot from you. So thank you for joining us and best of luck with the event in Chicago and at Project IMG.
Thank you, Dr. Sahgal.
Next is somebody, who many of us know. Her name is Imelda Tavas. She is a Chief Administrative Officer at SN Healthcare, oversees the academic division. She's also an IMG. And despite having a hands full and running the largest care management agency in New York State, she still finds passion of helping IMG by overseeing the NYREACH, the academic division. And, one of the few touching things I've heard from some of the IMG is that Imelda gave me a job, let me earn money, and it changed my life when I became financially independent. So thank you, Imelda. Appreciate you taking the time to join us. Floor's yours.
Thank you, Dr. Sahgal. I will share my screen and make sure that everybody can know the best resource that I could offer today for the attendees. We have NYREACH. I cannot toggle this. Hold on 1 second. Okay, there you go. So NYREACH is New York Research, Education, and Community Health. It is a nonprofit organization. We are located in the Bronx. And if you want to strengthen your resume and prepare for your residency, one of the best things you could do is put an experience in the United States where you could get in touch with the community that are underserved. So we offer a volunteer rotation for about 8 weeks to 12 weeks. And you can find out more information if you sign up for our listserv. There's a link below that I will post in the chat. It is very important to note that this is a free volunteer work. So we don't charge anything to you, but you will need to commit an 8-week minimum so that we can set you up and connect you with healthcare organizations in New York State. Of course, SN Medical is participating in our house call program. The community health volunteer programs allow you to rotate with physicians who go to the patient's home, as well as expose yourself in the underserved community and participate in community outreach events. That will be a good resume builder for you if you show that you're able to actually understand the United States healthcare system by volunteering. Another important note is this does not require a visa, so it is open to all, even those that do not have United States citizenship or green card. And for those who are looking for jobs while working on their next career move, we also offer jobs at snhealthcare.com. If you check our website, you can find all clinical assistant, clinical care coordinator roles that you will be able to actually join or apply for while working on your residency applications. Back to you, Dr. Sahgal. Thank you.
Thank you, Imelda. Appreciate the amazing resources you're putting in place, and I love for you to share that with all our speakers and the panelists too, for collaboration. Imelda has been instrumental in helping distribute information about this event. So thank you again. Next is, the main event. Thank you again for everybody who joined us as in the last half an hour or so for, talking about your organization, your passion. That was really is going to help thousands of people get into residency. And we have a shortage of practitioners, physicians. So we want to figure out how we can fulfill this need for physicians, practitioners, and help guide everybody. So your passion is very much appreciated. So, for the participant, if you want to thank anybody on the chat, feel free. If you have questions that you have coming up, feel free to put in questions. We do not have chat feature, only question and answer features. So again, just part of this webinar protocol we are following. Next is the 3 program directors who have volunteered to come and talk in this session. And thanks to Parag and thanks to them, you have one of the rare times when you can actually hear this program speakers. I'll do is I'll let each of the programs introduce each of the program directors and let them talk one at a time for the 5 to 10 minutes. And then we will have a panel with frequently asked questions moderated by Dr. Jamshed. So first is Dr. Vishwanath Vasudevan. Thank you, Dr. Vasudevan. I appreciate your finding the time and the passion for even joining the prep call. Dr. Vasudevan is Director of Internal Medicine Residency Program in Brooklyn Hospital. He's also Medical Director of the Sleep Center. He's a Medical Director of the Palliative Care. And he's board certified in more boards than I actually can even think of. He's board certified in critical care medicine, geriatric medicine, hospice and palliative care, pulmonary disease, and sleep medicine. And he is very passionate, and we love to hear from you and your life journey, Dr. Vasudevan. Floor is yours.
Good morning. Thanks for the invitation. And I would like to share my slides.
And, Raquel has probably done more work than any of us in organizing and sending email. And I appreciate you recognizing her. I depend on an everyday basis. So I've requested her to share Dr. Vasudevan's slides. So Dr. Vasudevan, the floor is yours.
Sorry for the technical issues. I mean, now we have the slides. And thank you for the very generous introduction. I think the focus of this seminar is all about interview. And briefly, what I'm going to do is take you through the process of how we select candidates for the interview and what do we try to evaluate during the interview process. Can you go to the next one? I mean, the Brooklyn Hospital is a community hospital. We have a university affiliated residency training program. And we have in all 90 residents, and every year we recruit 30 PGY1 residents. We are also a clinical campus for the St. George's University, and the medical students from St. George's University do clerkship with us. In all, we get about 5,000 ERAS candidates. Actually, the COVID pandemic has really made the applicant much more. And this year also we plan to do virtual interviews. And we have a selection committee, and we narrow this panel to 250 selected candidates. And we break them into different categories. The top tier are the US graduates, both allopathic and osteopathic medicine. In general, these US graduates, they have many more options. They have lots and lots of opportunities. And in fact, it is difficult to attract them to community-based residency training program. The next tier belongs to international medical graduates who graduate from offshore Caribbean medical schools. And most of them are US citizens, and they do clinical clerkship in US hospitals. So in a way, they have advantage that they do clerkship and they have in US hospitals. And most of the program directors have a knowledge how well they function. Then the last category, you talk about international medical graduates who are non-citizens, and most of them are not residents, and many of them really need a J1 visa. Lately, ACGME has been making a push for including diversities. They talk about equality, inclusiveness, and they want more underrepresented minority to be included into the program. And they refer to underrepresented minorities as Blacks, Latinos, and Native Americans. That said, these candidates are in high demand and they have many more opportunities. Next slide, please. I mean, this is the program perspective or the program directives perspective and where we come from and what we look for in candidates. ACGM is an accreditation body and it accredits all the residency training program. And the way they look at the quality of the residency program, there are two main program performance metrics. One is the ABM pass rate, which is the rolling average, and the benchmark is there should be 80% or more. And the second most important thing is the ACGME annual resident survey. So the program directors are very cognizant of all these things. So they would like to recruit people who are high performers and they will do well in the exam. And the second most important thing, whosoever candidate they recruit, they should be happy with the residency training program, and they should not be complaining about the residency training programs. The hospital priorities, the hospital reputation, the financial sustainability, the bonus, the penalty they receive, a lot depends on the patient experience and patient satisfaction. And the resident physicians are in the front line when it comes to delivering that. So very, very important that the candidates we recruit are able to provide high patient satisfaction and high patient experience. So the interpersonal communication skill, how well they explain to the patient and the family member, I think that takes a lot of priority. Next one. Again, the candidate selection, we would like to have high achievers for the reason already stated. We've got a very strong academic credential. And we always ask for people, have they done anything above and beyond the call of duty? Do they have the initiative? Do they have the motivation? Do they have the resiliency? Do they have the perseverance? The professional attitudes is very important, as already stated. The candidates who are recruited should have a good work ethics, and they should be able to deliver high patient quality care and also improve patient satisfaction. As already alluded to, good communication skills are important. I think good number of international medical graduates are non-native English speakers, and there are some countries where the medium of instruction is not English, so they may have some issues in communicating both spoken English language, and they may have difficulty understanding what the patient says or how they interact with the other healthcare providers. Also very important is interdisciplinary care, how well you interact with your colleagues, your superiors, also the ancillary healthcare personnel, and most important is patient and their family. Next one. To me, the interview process is just an extension of your ERAS application review. The medical student performance evaluation, also known as the Dean's letter, is very important for holistic review of the candidate performance. We also look for candidates who have US hospital-based hands-on experiences. And many of the graduates, international medical graduates, they may not be recent graduates, so the program director is always interested in what have they done since they completed the residency training program. And the most important thing we look for, are they in touch with patient care? Because touch with clinical medicine and engagement in clinical medicine is important. And already, what has been already alluded to, the reference letters is most important. But again, there should be no conflict of interest. And the person who writes the reference letter should attest to your medical knowledge, clinical competence, professionalism, how well you interact with the patients, how well you treat them with respect and dignity and empathy. And we like to see the personality trait, initiative, motivation, self-directed learning, resiliency, and perseverance. I think most reference letters are satisfactory. So we would like to see some superlative performance. So the reference letter should clearly state that you are on the top fifth percentile, you are excellent, superior. Just saying good is not good enough, because most of the candidates get an average satisfactory reference letters. Next one. The interview process, this is what AMC guidelines are. So situational, behavioral, situational, usually you are asked to explain any adversity you have encountered in your life and how did you overcome that. And behavioral is all about your personality, your honesty, integrity, resilience, and perseverance. And also the medical knowledge is important, and that could be tested. What we look for in the Dean's letter or the medical student performance evaluation, any awards, any honors, anything you have done to stand out from the rest of the crowd of applicants, any special recognition. I think most of the MSP, Dean's letter, they follow the AMC format or AMC template. So the class standing is also important. Where do you stand? Are you in the top 10 percentile? Professionalism. I think a lot of program directors put lots of emphasis on professionalism. And if you have done a research, is it meaningful research? Whether you were the first author or you're the primary investigator and you played a key role in writing the manuscript. Also, the volunteer work should be meaningful. Next one. I mean, every program uses their own evaluation tool. And this is the tool we utilize to score our candidates. We use the ACGME 6 core competencies: medical knowledge, patient care, professionalism, interpersonal communication skills, system-based practice, which is interdisciplinary care, and also practice-based learning improvement, which is your knowledge of evidence-based practice, and self-directed learning. And most of the candidates are graded into these three categories: unsatisfactory below expectations, satisfactory at expectation, and superior and above expectation. Most of the candidates we interview, they fall in the category of satisfactory and expectation. So again, you have to distinguish yourself from the whole pack of candidates and applicants here. Actually, our acceptance rate once you're called for interview is about 65%. So the very fact you have been called for interview, there is an exceedingly good chance that you'll be selected. And if you are ranked in the top 100, there is 100% chance of getting the residency training program. Next one. And how well prepared you are for starting the residency training program. And again, I am quoting the AMC. They have identified 14 entrustable professional activities. And we put a lot of emphasis on the medical student performance evaluation, the Dean's letter. We look for any gaps in education, any remediation, any repetition, and the GPA, the class GPA, and also your class standing, how well you have compared with your peers. Next one. Again, medical questions will be asked. And again, I'm looking at those entrustable professional activities based on AMC guidelines. And these are some of these entrustable professional activities the resident should be able to perform on the day one of a residency training program. So some of the common questions are asked is that they may be presented with the lab abnormalities, and you should be asked to interpret the lab abnormalities. Or you may be given a clinical scenario and you should be able to come up with a differential diagnosis. Or you may be asked to describe a case report, give an oral presentation. Next one. Or they might test you about your knowledge about evidence-based medicine, and also how well you collaborate with other team members, because interdisciplinary care is very, very important when it comes to patient satisfaction. You may be asked to describe a clinical situation which requires urgent evaluation and management. And you may be asked to how well you will get an informed consent for a procedure. So these are the things one should be expecting in an interview process, and one should be well prepared to handle some of these questions which are frequently asked during the interview process. Again, it's very important for the candidate to express genuine interest in the program. The more you know about the program, the better you are, and your priorities should align with the program priorities. So that's very, very important. Thank you, and that's the end of my presentation. I'll be more than happy to answer any question if any of you may have.
Thank you, Dr. Vasudevan. We will hold the questions towards later with Dr. Jamshed, but it is amazing. That is so informative. Thank you again. To be continued, I'd like to introduce the next program director, Dr. Gunturu, who I have the fortune of knowing since he was in the Bronx, Lebanon residency program. He does nowadays pretend to be a little older with a beard and a mustache. You can't fool in people like me, Dr. Gunturu. Dr. Gunturu has completed residency in Bronx Care Health System, where he was a recipient of both the American Psychiatric Association Resident Recognition and the Department of Psychiatry Leadership Awards. He's a trailblazing fellow and an attending, having completed fellowship in consultant liaison psychiatry in University of Miami, where he also received the APA Resident and Fellow Recognition Award. He also completed yet another fellowship in public psychiatry at Columbia University. He currently is a director of psychiatry residency training program at Bronx Care. He's also the director of psychiatric integrated services at Bronx Care MLK, Martin Luther King. And he's consulting chief of behavioral health at SN Healthcare, where he is able to take care of thousands of underserved patients by giving his advice to the behavioral health division. So floor is yours, Dr. Gunturu.
Thanks for the lovely introduction, Dr. Sahgal. Speaking after two speakers is always like there is some good things and some bad things. The good news is like you can hear so much and you can gain a lot of wisdom yourself. The bad news is there is not much to speak after somebody who has done so many extensive presentations. But I'll do my best. And also psychiatry interviews tend to be a little different in comparison with internal medicine and other specialties. So the way and I'll try to keep this 5 minutes or less than 5 minutes talk is going to be mostly about like once you get into the interview. I'm not going to go extensively about our selection process, but I'll speak a little bit about what we have to do with regards to the interview. So first of all, for example, in our program, out of 1,400 applications, we get around 1,400 applications for 8 spots. And we interview close to 80 people. So it's 1:12 ratio, approximately 1:12 to 1:13. So if somebody made it to the interview in whichever residency program you're applying to, you should be, whatever has happened in the past has happened. So it's just like you're starting something new. Just prepare for the interview and be confident about yourself. So, and the way I see interview is of 3 different categories. One is pre-interview preparation, then what happens in the interview, and then the post-interview, what the things you have to do. So in pre-interview preparation, in this, especially with the digital age, and we do a lot of interviews virtually. So the things you can do is make sure that you check your internet is fine, especially if you're coming in from a different country, or if you're kind of zooming in from a different country. Make sure all the settings are in place which you want. Make sure that you're if there is something that you want to share with the interview team, make sure that everything is in place digitally. So, and then afterwards, check your background. As the speaker before me was mentioning, don't try to put any affiliations or any kind of religious or political affiliations as much as you can. So essentially, it is the digital hygiene check that you want to do before an interview. Once that is done, then the other thing you want to do is practice with a few of your friends. And also nowadays, there are so many IMG resources which are available where you can practice an interview. And if you have somebody who is a PGY1 who recently started his or her residency, you can always talk with them or try to do a mock interview with them, because it's very important to know your weaknesses more than your strengths. Your strengths are going to be your strengths for sure. And weaknesses are called weaknesses because that is what you can work upon and get better on. So there is a fine line between being rehearsed versus being thorough. So it's always important that your answer should not be like as if they're rehearsed, versus you have to just try to be as your thought process should flow as much as you can. So this can be done with practice. If at all you see that is an issue. So these are the things you want to do before an interview. If you're doing an in-person interview, the same thing. Make sure you're actually trying to go before time. Have your clothes pressed. Have your make sure how you want to dress up for the interview. Be aware of all. Be cognizant about these things. This is the pre-preparation. And during the interview, especially with regards to psychiatry, I can tell you with guarantee that we like good scores, but scores is not everything for us. We want the person to be interesting and engaging. If we are spending the next 4 years together in one residency program, we don't want to be around people who are boring, I would say, for lack of a better word. So we want folks to be as engaging and interesting as possible. So we actually have psychologists, we have clinical social workers, we have different people interviewing the candidate when they come for a psychiatric interview. So the things which I can tell for IMGs is be clear, be slow, be concise. You don't need to rush, don't feel anxious. So you have the 30 minutes is your 30 minutes. So try to engage the interviewer as much as you can, and you can actually follow their leads and go in the direction what they want to go into. So, and also most important thing is all throughout the process, don't try to be interesting for the sake of being interesting. So be honest. And if there are some hobbies that you want to say, tell the hobbies that you actually do. Don't tell something because it sounds interesting, because that the interviewer might be having the same hobby, and then it just becomes a very uncomfortable conversation for the next 30 minutes. So, and most of the times, the things which are represented on your CV, make sure that you go through your ERAS application and you're willing to talk about something. Sometimes when when we ask folks about some research work they did, they're not able to kind of give us a coherent answer. So, and also failures, I'm not talking about exams, but in general, failures in life, I think it can be of a gap year, it can be of a gap between step 1 and step 2, it can be anything. For me as a program director, it's okay to kind of fail, but it's important to fail well, because failing is the one which is sometimes, those are the things which teach you the most than your successes. So it's okay to fail, but you have to fail well, and you should be able to explain what is the reason, what happened, and what are the learning experiences you learned from it. So make sure that if something like that is in your statement, that when it comes up, you should be able to give an explanation. So, and during this whole process, something you want to be aware of is like in your interview, show passion, and also be passionate all throughout this journey. It's a marathon, it's not a sprint. So, and also find some relaxation plans for yourself. Try to make yourself be healthy, go to the gym, or maybe you can run, hydrate yourself, build relationships. Sometimes during this process of USMLE on this whole residency preparation process, you might build relationships, which can be lifelong relationships, which are important, because you're having a nice social knit is going to help you get through many of these phases. So with that, I'll mention the last 30 seconds about some alternate pathways also. So in general psychiatry, there are so many alternate pathways because 60% of our fellowship positions tend to be not filled. So there are different ways you can get into like psych fellowships even before you start your residency. Sometimes you just need to know how to do it and what to do. And also, for example, different pathways like MBA, MHA, and all of these MPHs, these are all actually, I report to an MBA in the hospital. So there are many things that alternate pathways that you should not be giving up for. And also the psych NPs, we have psych PAs, we have so many other alternative pathways in psychiatry that are, because given the underserved nature of the specialty, there is so many opportunities available. So please have a plan B, as a couple of speakers were telling before me, and try to know a lot about the community of the hospital which you're serving, because right now the trend in the US is moving towards the healthcare systems are not just thinking as shareholders, but they're thinking themselves as stakeholders in the community. So it's important to know whichever community you're going into, try to understand what is the spirit of that particular community. With that, I'll be happy to take a few questions later on.
Thank you, Dr. Gunturu. So well said. And just quick thing, you mentioned about academic papers. Any thoughts before we go into the panel discussion on academic pursuit?
Academic papers in the CV.
When you said your scores are not so good, but then how does it go with academic?
So for us, especially in psychiatry, as long as folks don't have attempts, which is fine. But the reason why we see for them not having attempts is also because it's the best reflection we have at this point of time for the board pass percentage. So that's the reason why. But academic papers, so we in psychiatry, what we see is how much passionate they are about getting into psychiatry. The way we can gauge that is by seeing if they have publications, if they have national conference talks or any kind of conference talks, which are very particular in psychiatry. And also the US clinical experience. If they're Caribbean grads, we try to see if their electives are in psychiatry or not. or if they're like international medical graduates, if they have done the US clinical experience in psychiatry. So the academic papers help us to know how passionate somebody is in psychiatry.
Got it. Thank you, Dr. Gunturu. Amazing, and more to come. I just want to introduce Dr. Nayan Kothari. Dr. Kothari is an FACP and FACR, is a chairman of the Department of Medicine and program director at the Internal Medicine Residency Program at St. Peter's University Hospital at New Brunswick. He's a graduate of Mysore Medical College in India, completed residency at St. Peter's. He became a Master's of American College of Physician, MACP, in 2014, and is a governor of the New Jersey Southern region of the American College of Physicians. And, he is on so many boards, has so many positions. It's difficult for me to tell everything, but I pass on to you, Dr. Kothari.
Thank you. Thank you very much, Dr. Sahgal. I'm very pleased to be here. Thank you for inviting me. I want to thank the Medical Society of State of New York and its leadership. I also wish to particularly thank Rachel Smith, who guided me through this process. Let me reintroduce myself. I am an IMG. I came to US about 50 years ago and has been a program director for about 40 years. I've interviewed more than 8,000 candidates and have graduated 800 in my 40 years. I've been a chair of medicine at St. Peter's, and I do many other things as mentioned. But I do believe that each one of you can do the same or even better than I have done, because this country gives you the opportunity to do that. Now, today's topic, I have a few minutes, is limited to the interviewing process. But please note that a lot of work has to be done before you reach this stage. But I will limit myself to the interviewing process. Over the years, after interviewing numerous people, I learned a number of do's and number of don'ts. And I want to share them with you. Number one, prepare for the interview. Since it's virtual, people are getting lazy. They are not doing things as they should be doing when they appear in person. Since most of the interviews are virtual, make sure that your equipment works. We just saw the consequence of equipment not working 5 minutes ago when we could not present these slides. That should not happen to you when you go for an interview. When you choose your background, make it simple and plain. Do not send a political or religious message on your background. Make sure that you observe a professional dress code. This is not the time to declare your political or religious affiliation. Make sure that you are able to explain any inconsistency in your application. There's nothing wrong having an inconsistency such as a gap, but you should be able to explain it. You should be able to explain your research as well as any publication you may have. If this is important, and this comes up many times, so I want to spend a minute or so. If you are changing your discipline, let's say back home you did surgery for 5 years or 3 years, and now you're applying for medicine, so you're changing your discipline. Do not say that you love this new discipline, because nobody will believe you even if you do. Simply say that you would like to go into surgery, but since your chances are slim, you would go into medicine and you have enough energy and vitality and interest to succeed. I think that is more believable. Most program directors believe that. Ask good questions. You cannot ask good questions unless you have done research on the program and the program director. So look it up. In medicine particularly, be very careful about questions on fellowship. Remember that you are being interviewed for internal medicine. Fellowships are 3 years away. And if you focus on fellowships, some, not all, program directors will get ticked off. So how do you handle that question if fellowship comes up? You say that, I would suggest you say that I would like to become a top-notch internist first before I decide about fellowship. And I hope you will guide me. That is more plausible answer. And finally, you will be judged, you, I, everybody, all of us are judged by two things only in life. One is your appearance, and the other one is your speech. I think this has been mentioned earlier. Now, when I say this to my residents, to my friends, they say, well, how can you say such a thing? Because you have a God-given appearance, which you cannot change. True. You cannot change your God-given appearance, but you don't have to make it worse by wearing loud clothing, not combing your hair, all those things. Speech is very important. I come from India, where English is taught at a grade school. So when I first came here 50 years ago, I assumed and believed that I speak the best King's English. I didn't. Grammatically, my English was better than most Americans. But very few people understood me because I was speaking Gujarati and English together. And that's what most of our international graduates do. They do not communicate, and that is when decisions are made by program directors whether they will accept you or not. What I recommend that you look into this, practice on a tape recorder, watch television anchors, how they speak. There are organizations free of charge which will guide you through speech. Many universities have it. Rutgers in New Brunswick has a program like that. It's an international program. And please do not mumble. You need to speak from your diaphragm, not from your clavicle. You should be heard. It doesn't matter what you say. If you are not heard, they are not going to consider you. These are just a few ideas which I have gathered over time, and I hope you will pay attention to them. I will be happy to answer any questions later on. Thank you very much.
Dr. Kothari, thank you so much. Amazing words of wisdom. Just want to ping you, last time we talked, you talked about these other opportunities you don't think are very credible. Could you just add a little color to those other ones that you mentioned? Plan A, Plan B?
Oh, yes, absolutely. I tell candidates who interview with us and who do a rotation with us that it's a matter of math, it's a numbers. It is not your fault if you don't get a residency. But that is not the end of the world. You must have a plan B. There are many plan Bs available, but you need to explore that very carefully. Plan B includes career outside residency. You can go to industry. You can do research. You can get a degree such as an MPH, Masters in Public Health. Even nursing. I think Dr. Mehta has initiated such an event. I just learned that last night. There is no lack of dignity in changing your pathways, but I think thousands of candidates who are here, I meet many of them almost on a daily basis, and I see that there is no plan B. Not only that, they go after the residency, which they should, but then they spend enormous sums of money, time, energy, and they don't get any yield. Now, this is not the time for me to tell you what not to do, but there are a number of things you should not be doing, such as some of them, what I call bogus rotations. They are available and you are being exploited by physicians like me. They take you in their office, you do this cut work, and then they write you a letter. My fellow program directors here will not agree with me, but I will tell you in frankness, I never read a recommendation letters of anybody, including US deans, because they never say anything I want to know. So be aware of that. And I know you pay and spend a lot of money to get those letters. It's nice to have one or two letters, but don't sweat it out. I think this is all I have to say right now. Dr. Sahgal, anything else you would like me to answer?
No, Dr. Kothari, it is so good to hear from you from, in such a down to earth words that I don't think the international medical graduates can get from anybody else. You have created this amazing access by being on this IMG webinar, and look forward to some of the questions later in the session with Dr. Jamshed. So appreciate it. And I'd like to go back to Dr. Vasudevan. We're going to have a panel discussion with frequently asked question led by Dr. Namira Jamshed. I just want to do a quick introduction about her. Dr. Jamshed is an associate professor in the Department of Internal Medicine and Family and Community Medicine at University of Texas Southwestern Medical Center. She's a specialist in geriatrics and dementia. She serves as a medical director of UT Southwestern Care for Vulnerable Elderly Home-Based Primary Care Program. She earned her medical degree in Aga Khan University Medical College in Karachi, and she is also very involved in the APNA organization, which is Association of Physicians of Pakistani Descent of North America. So the floor is yours, Dr. Jamshed.
Thank you, Dr. Sahgal. And thank you to all the speakers and experts and helping our international medical graduates understand things that they need to do, the do's and do nots. So we'll dive right into the Q&A. And I know there's some questions, but I'm going to start with a list of common questions that we have collected over the last previous webinars. And I think I'm going to try to go in order for the speakers, but then if any other panelists would like to add an answer, please do that. So the first question that I think everybody wants to know how to answer for the interview is, tell me about yourself. So Dr. Vishwanathan, would you like to address that, please? How should an applicant during the interview respond to the question, tell me about yourself?
I think the most important thing we would like to hear, what have you done above and beyond the call of duty? What have you done to distinguish yourself from the pack of applicants? So any honors, any awards, and also any adversity you have overcome in your life. I mean, I think that's what most of the program directors would like to hear.
Sure, thank you. I may also want Dr. Gunturu to answer the same question, and I'm wondering if you're looking for something different. I know psychiatry and family medicine both perceive interview a little bit differently from other specialties.
Yeah, so when it's an open-ended question to tell in psychiatric language. So when you ask somebody about yourself, the idea is that what I cannot see in the 30 minutes of interview, I want the person to speak about the things which I probably would not be, just like our patients, when in the 15 minutes, we would really not know what's going on in their life. So we kind of want to know in the outside the 30 minutes, how would I know about this person? So when somebody asks, tell me about yourself, I would not just think about the residency program. I would just say mostly about my family, how I'm a middle child, how my parents were educators, and how it kind of imbibed a certain kind of qualities in me that helped me to think about medicine early on in my career. So I'm just telling about myself as if I'm doing the interview, but I usually say that. And then also, as Dr. Vishwanathan was saying, I would love to hear how they went through a problem, if they have come through a problem, because I always like to see how people, what you see when something bad happens and you come out of it is the character. What you see every day is personality. So it's different. It's nice to see what kind of character people have, because the hospitals nowadays in the US are not, these are pretty high pressure localities. So that's how I would see when somebody asks.
Yeah, and that's the feedback we've had from most psychiatry program directors and family medicine. For that question, they want a more personal answer. And for internal medicine, maybe general surgery and other specialties, it's a little more like Dr. Vishwanathan was saying about your achievements and what you bring and how you've handled adversity. So the next question for Dr. Kothari. Dr. Kothari, we often ask applicants questions about strengths and weaknesses. I think most people are good at answering about strengths and maybe even go a little more than what we want to hear. Can you address a little bit how they should answer the weakness question?
I think, first of all, in all these questions, even the previous ones we just discussed, I will tell the truth. Because the program directors are smart enough to pick up anything exaggerated. So be humble, tell the truth. If you are weak in certain things, it's perfectly okay. But then you turn it to the program director. But I hope this is my weakness. I am slow in processing patients, but I hope your program will teach me to be more efficient. I think I, as a program director, would like that answer for the resident, for the student to tell me that. Because we are forming a relationship with two of us. I know this question is asked, and I've looked at it for years. I don't think there is a good answer, frankly. So tell the truth. That's the most important thing.
I really like that idea of being honest and showing vulnerability. I think applicants sometimes forget that as we're growing as physicians, we're also vulnerable. And what they could add, Dr. Kothari, is that if they do mention a weakness, they can talk about how they plan to overcome it, so that you as a program director are not left thinking, what have they done so far about it? Would that be correct?
Absolutely, absolutely.
Okay.
That's a very good addition. Yes.
Okay, excellent. All right. So the next question is. This has actually been brought up that we know that there are certain questions interviewers are not allowed to ask about sexual orientation, family, marriage, children, how many children are you planning to have? But we've had occasions where people have been asked those questions. And as international medical graduates, we're a little more, we're worried and scared that if we say that this is not an appropriate question, we might get, we might offend them. So what's the best way to tackle a question that we feel is too personal? And let's see, who would like to address this question if they've gone through this before? I actually can't see all the panelists, unfortunately.
We at our, this is Nayan.
Go ahead, Dr. Nayan.
We have a list of things they should not ask. Our hospital provides that list.
Okay.
So all our faculty who interview, they upfront know that they cannot ask the following. And that has helped a lot, because years ago when we did not have this list, people would ask all kinds of nonsense.
Okay.
And times have changed. They need, so I would prepare the faculty first, those who are interviewing, and I think that has worked for us.
Okay. Dr. Gunturu, do you have any?
So we do have the same thing. We have an etiquette that we get folks to sign, the interviewers to sign them before they actually ask questions, the things which we cannot ask: religious, political affiliation, sexual orientation, etc. But irrespective of that, for the sake of the audience, if somebody asks that kind of question, how do we respond? So for me, I would say, depending upon how bad of a question it is, versus if somebody asks how many children you have, so that is something probably I'll be okay answering, versus somebody asks me about my sexual orientation, then probably I think whether I'm an IMG or AMG, I think most importantly, I'm a human being. So I would just say, I just don't think I'll be able to answer that question. It's a personal preference. I don't think anybody would be offended with that. And also, if they're offended, and if they actually go to the selection panel and they will tell somebody that they asked this question and that somebody answered, that person will be kicked out of the panel usually.
That's true. And then also for applicants to remember that if you do bring anything up in the personal statement or in your CV or while you're doing the interview, then it does allow the interviewer to lead into that question and ask you more questions. So if you want to avoid personal questions, you should avoid them from the get-go. And otherwise, as you know, if anyone does ask that, if they're actually not allowed, just nicely tell them that I'm not sure I'm comfortable answering this question. This other question is very common, and I think either Dr. Vishwanathan or Dr. Kothari already touched upon this. a lot of international medical graduates have already done specialties or training in their home country. And then they come here and they're applying for a different specialty. How do they tackle that during the interview? Any of the panelists who are comfortable can raise their hand, and then I can can talk. Again, yeah, go ahead, Dr. Kothari.
Yeah, I get this question almost every year we interview. The most common scenario is somebody has done surgery, orthopedics, or OBGYN, and now applying for medicine. The first question I ask, why are you changing? They have qualification, postgraduate degrees, they have practiced orthopedics back home. And the answer they give is almost laughable. Well, I always wanted to go into medicine, and now I love to go into medicine. And I tell them, when we prepare them for interviews, that that's the wrong answer. First of all, nobody's going to believe it. Secondly, be honest. Tell them that I would love to go to orthopedics, but my chances are slim. But I'm very adaptable, I'm very hardworking, and I could become a great internist. That sounds good, it's true probably, and we have successful models. I'm sure you have too, those people who have done that. So this is how I would answer. But to say that I love this discipline all the time, and now I'm going in, does not sound right to me.
Dr. Leong, do you have anything to add to this?
Yeah, so I agree with that. So I think basically, what they should say, like the chance of getting those specialty is very slim. But I'm always a great physician. I'm always like to help the people. You know, I'm always a good teamwork. I still want to be a doctor, so I think medicine is my the best choice, and then I will be very interesting to be a internist or something like that. We should mention that you're still passionate about the medicine. You're still passionate about to be a physician, to help the people.
Thank you, Dr. Leong. Are any of the panelists here international medical graduates who were in different specialties in their home country and then came to the US to do something different? Okay, all right. I did general surgery for a year. Like many IMGs, I came here to do general surgery. It was a passion. I did end up doing family medicine after for different, personal reasons. But again, there's always a story, and you can be honest about that story. And I think what they do is, when I interviewed for family medicine, they called my general surgery faculty, the different ones who gave the recommendation. They just wanted to know what kind of person I was, what kind of resident I was, I was hardworking or not, and did I finish my tasks? And that's the story that you would tell. So do not think that because you have a different specialty back home that is a red flag or a hurdle. So next question is for Dr. Barmecha. How should the applicant address any red flags? And I think there's some confusion, Dr. Barmecha, if you can also talk about what red flags actually are, and that they're not, whether they're weaknesses or they some hard red flags that we need to address.
Well, thank you so much, Dr. Jamsher. As I said in the beginning, please review your ERAS application and the CV, what you are sending. Sometimes they inflate the clinical work, whether it is in US experience or elsewhere in their home country. And as I said in the very beginning, when you interview, you know that some of the work they have done are not are kind of inflated. In same thing in the research also. If you are not the first or second author, just be honest about it. I think the honesty is very, very important. And the when a APD or chief resident or program director, when they interview, they can look into your eyes that this level of work cannot be done during observership or when you are just helping out in data collection for the research. So those are few things I would say that try not to inflate your scholarly activities or your clinical experience, because it's like your customs officers. When you come at the airport, you say you don't have any food materials from India. They know that you are bringing some food materials from India. So just be careful about your work. It's not a good analogy, but I think the custom officers, they know.
We got investigated by the officers because we brought achar, which is pickle. And then while they looked at the pickle, they found pan. So you're absolutely right, Dr. Barmecha. I think we've seen applications. Yes, of course, please do.
Yeah, I think the honesty is very important, and whatever you say, you should have a track record to back it up, that you have done something, you're not just making some promises.
Correct.
And let's say for the sake of discussion that you didn't do well and you had to repeat it, don't give some excuses. I was very sick, or there was sickness in the family, I couldn't do it. I think most of the program director will appreciate the honesty.
Thank you, Dr. Vishwanathan. That's fair. That's very true. There's due to the pandemic, especially a little bit better this year, and this question's for Dr. Ang to start with. A lot of international medical graduates have not been able to get US clinical experience. Many are trying to do observerships, and even that's becoming very difficult. How should they address that during the interview?
This is for Dr. Leong or for me?
Yes, for you.
I'm sorry. Well, you know, they are many people that actually rotate through my practice. I'm an OBGYN. I happen to have a freestanding birthing center. So there are many people out there that have ambulatory surgery centers that actually would be something that's in between, you know, the office and the hospital. And I think having experience in something that's in Article 28 may be something that would look better on the recommendation, on the letter of recommendation. I have been able to get my friends that have ambulatory surgery centers to allow them to observe in orthopedics or to observe in podiatry. I'm a surgical specialty, so ASCs seem to be a good interim. I don't know if anybody else has had that experience or were able to offer that. I've also been a program director for 13 years, so I do know that at least that gives them something a little bit closer to a clinical experience. May not be hands-on as much as you would like.
Well, then Dr. Ang, let me ask you a question. What if someone is applying to your program and they've had no clinical experience in the US at all? And you know, the application's great scores, great work, maybe even an OBGYN from their home country, but have never been to the US.
You know, honestly, when I was interviewing people, I used to tell them, you know, it's great to see that you have experience or the experience that they had in their country. But I tell people the residency is the place where I'm supposed to train you. You know, I almost feel like asking people, how would you manage an abnormal vaginal bleed, or somebody in the third trimester walks into the OR, you know, OB, labor and delivery. And I tell them, if you don't get that question right, it is my job for 4 years to train you in that. I want to know, I mean, the interview is a date, right? This is speed dating to me. So I want to know, am I going to like you? Am I going to want to hear from you at 3 o'clock in the morning? Will you be able to articulate to me? And just like all the other presenters have said, will you be able to speak to the parent, to the patients? How do you address family? Are you going to be a problem child for me during the residency, right? Because we're all den mothers. It's like having 12 children or 16 children or 60 children if you're an internal medicine program director. So I'm looking at personality. I'm looking at flexibility. I'm looking at the ability to withstand stress, because it is an extremely stressful time. I want to know that you can stay up 24 hours, you know, and not complain. I mean, you can complain, but obviously we're looking in surgical specialties for a stronger back. You know, you need to be better than everybody else, unfortunately, right? As an IMG, I mean, when I was a DO coming up, I always felt like I was a second-class citizen. So, and as a female in a surgical specialty that was 90% male. So, you know, you end up having to feel like I have to be able to dance backwards to get into the program. I'm looking at personality. I'm looking at eye contact. I'm looking at how you dress. I look at how you carry yourself. I look at honesty, genuineness, you know.
Thank you, Dr. Ang. Thank you. Any of the internal, yeah, Dr. Kothari?
I would like to do small things. And this is not doing the interview, but when I meet with international graduates when they do these observerships, I meet with them regularly, every week almost, and I tell them a couple of things. Number one, just to get, quote, US experience is not enough because they are misled into third-rate, bogus experiences all over. And I feel terrible about it because they pay tons of money. There are people I know personally who would ask the student how many recommendation letters you want, and it will cost you $700 per letter. I have proof for that. That is obscene. It should not happen. So rather than, and then program directors like me know these things. So when we get those letters, that candidate is automatically out because it is substandard. And I tell them not to do this. You know, there are wonderful places in this country they can go to. The other thing they ignore, back home. There are fantastic places back home. Many, I don't know too many or all countries, but I do know subcontinent, India and Pakistan. If a candidate tells me that he did a rotation at Aga Khan or All India, that's enough for me. I don't want them to go to Mayo Clinic. That's perfect. So they ignore this sometimes. They can do a postgraduate studies in back home for a year or two, and then they come here. So there are many options, but they need to be told upfront ahead, not during the interview.
Okay, thank you. Dr. Barmecha, you wanted to add something?
Yeah, just piggybacking on what Dr. Ang mentioned regarding the clinical experience during the COVID. This is relatively new. It was not there in my time. Virtual care and remote patient monitoring. So those are the avenues I think the IMG can try if you have the opportunity of getting involved, because bricks and mortars are not the only where clinical care is being provided, and virtual care or remote patient monitoring is going to stay. So look at other opportunities where you can provide care. And I agree with Dr. Kothari that, as I said, I mean, we can look into the eyes of the candidate and say whether this was a legit clinical observation or not. So even if it is COVID time or social distancing, there are a lot of other opportunities. You can do remote data analytics work. You can get involved in research. So there are opportunities working from home as well, actually.
Thank you. Maybe Dr. Bennett, if you could answer this question. I think many of the questions are relating to this. Once the interview is done, what do programs expect from the applicants? Do they expect an email, a phone call, a card, a thank you? If they don't send it, how does that affect them? If they send it, is it okay to send it once? Should they send it twice? So you get the gist of it. Any thoughts on that?
Not particularly anything specific, but I do expect a letter on a plain white paper. Okay. Definitely not on a Hallmark card, because sometimes they do this touchy-feely things. It annoys me considerably. But they can send me on a white paper or an email. Thank you. If they don't, it has no implication for my selection.
Okay, thank you. Anyone else have any different thoughts or ideas?
As far as I'm concerned, it doesn't add any value because we get inundated with so many emails and some of them may not even be looked at.
Yes,
So,
go ahead.
Yeah, if I can add one thing with the post-interview, I think from our point of view, so if they send an email, it is fine, it's well and good. Sometimes writing much more like a personal thing, what a discussion in the interview, which can probably resonate with them. So, and if they mention those kinds of things in the email, it's probably good. But if they don't send anything, we would never hold it back. And also there is a fine line between saying thank you versus being creepy. So we also have to make sure that we are not overdoing things like sending an email for example, the same person emails and then they send a LinkedIn message and then they send you an email. Sometimes they send some chocolates and stuff like that. So it's true story, by the way. So these kinds of things. So kind of being not overdoing it, but at the same time, you can always write a nice thank you email if it really resonated with you. And also, it's important to remember that from the program point of view, we are equally excited to get good residents. So if we find somebody, whether you send a thank you email or not, and if we like somebody within like 2-3 weeks, we will reach out to. If somebody did not reach out, that means they probably are either put in the second trough or maybe for a second look. So it's important to realize that it's a symbiosis. It's not a commensalism.
Thank you. Dr. Eng, you had your hand raised.
Yeah, very quickly. I mean, I've been the executive director of the Brooklyn GYN Society, as well as Kings County and Bay Ridge Medical Society. And I've had students that are lucky enough to be in the States and that have done the rotations. And I tell them, join ACOG if you're interested in OBGYN, join, MSSNY, join whatever societies or specialty society or ethnic medical society to network, because the opportunity to network, show up. I've told them, come to our conferences. When I was the program director, we have a teaching conference every Thursday morning. Well, we've had students that showed up consistently just to show interest. They sat in the back of the room, and that told me that there was a commitment, that they wanted to integrate. So they went a little bit above and beyond. I don't want them to be creepy and start sending me chocolates and emailing me every week, because that's stalking. And there are laws. But I think that if you just join some societies and try and get in that way too, and do research, present at poster sessions when they're available,
Thank you. Thank you. Dr. Barmecha?
Yeah, just a couple of do's and don'ts. So if you are doing an in-person interview, as soon as you come to the main entrance, be polite with everyone, be confident, and everybody is observing you, from the clerkship or program director, coordinator, through chief residents, or even if you are doing walkthrough, be attentive, because I have seen many at times people are on their phones. They are not paying attention to what chief residents are. So every feedback is very, very important. So those are some of the don'ts. And the other don'ts are, please do not come back for follow-up without solicited. So many of the time residents will come, I was just making sure that you got my email. You don't have to come to the program director's office to confirm your email whether it had come. It's a big red flag. Please do not do those things. And as I said, the big do's are pay attention. You are only there for one reason, it's interview. You are not there for looking at the architecture of the building so be very, very attentive. Every feedback is important, because for program directors, the chief residents, APDs, and the clerkship director or program coordinators are the eyes and ears. That's all.
One of the other things, thank you so much for that, you can do is that if you connect with an interviewer during your day, or even one of the residents, I think it's okay to send them one email, and they will then convey that to the program director. It doesn't always have to be the program director and the program coordinator. You can send an email a little more personal to someone you connected with. So I'm going to change gears, and we're going to go to some Q&A, because there's a lot, and we do want to stop at 10:30. So we will start with, some of the questions have been answered, and some have not. I think this is a very good question. Dr. Thapa is asking, how do you tackle the behavioral question? I think one of the program directors, maybe Dr. Kothari or Dr. Vishwanathan, had mentioned the AMC guidelines of some of the questions. So anyone want to take that as to how to respond to a question about behavior or behavioral activity? Or how would you ask that question to the applicant?
I'm not following.
Dr. Bennett or Dr. Smith? We haven't had a chance to hear you.
Sandra Bennett and Michael Reyes are our MSSNY staff in helping us.
Oh, I'm
So
sorry.
my
I did not see
oversight.
Michael. I apologize.
I
All right.
pers-
Okay. Well, then anyone. What kind of question would you ask to see if they can tackle any behavioral?
So
maybe Dr. Yeah, go ahead.
Yeah, I am the behavioralist probably. So what we usually do is we have like 3 questions that we ask in general to kind of see what kind of behaviors you can expect. But again, this is mostly, as somebody was mentioning before, it is mostly speed dating, so it's very hard to understand. But a few of our questions are prepared by psychologists. So what they ask is like 2 things which we do is we actually show them a picture and ask them to interpret it in whatever way they can interpret. And the kind of answers we get are like so varying because the same picture is seen by different people and they see and they tell it in different ways. So that kind of gives us an insight into what their psychology or how they kind of think about things and how their perception is. Because the same stimulus can give different reactions from different people. So that is one thing which we do. And the second thing which we do is also we ask about conflict resolution, which is a very common question. Because we also ask is if you happen to disagree with your attending on the floor about a certain medication or a treatment plan, how do you intend to resolve it? And that is also we see different people. And I always thought people rehearsed, but sometimes when we go back and see, actually what they told us in the interview is the same behavior they do when they are on the floors. So actually sometimes I think that conflict resolution question is also helps us to understand people's behavior. Those are the 2 usual techniques that we use to understand people's behaviors.
Thank you. We have sometimes asked for them to give us an example of a conflict that they had to address and how they did that. So sometimes we've done that. So there are different ways of doing it. There's a lot of questions about old graduates here, and I was wondering if some of maybe the internal medicine program directors or could address that. What is old? First of all, what's an old graduate? And there are a lot of disheartening information out there, maybe even rumors. What would you recommend for them? Maybe we'll start with Dr. Kothari and then Dr. Vishwanathan and Dr. Barmecha. Go ahead, Dr. Kothari.
Yeah, you're right. This comes up frequently. There are people who graduated from medical school 12 years ago. What I look at, and I'm sure my fellow program directors look at, what they have done afterwards. If they graduated and then they went into a solo practice in a small town back home without any academic exposure, then that candidate is not for me. It may be great, but not for me. But if they did some postgraduate work, they continued to do something meaningful in a meaningful place, I would definitely consider that. In fact, I would favor that candidate if they have the life experience. Yeah, you know, in all walks of US, if you want to do graduate education like MBA, they expect you to go for 2 years of business before they would even consider. Medicine is the exception. We don't do that. But some of the best residents I have had are those who spent 2-3 years doing some meaningful work in different parts of the world. So I'm not biased against them, but I would like to know what they did after graduation.
So the rumor is that there's filters that filter them out after 5 years.
I think
Dr. Vishwanathan, go ahead, Dr. Kothari.
No, I'm sorry to interrupt. It is a fact, there are filters. But the reason for the filter is simple. When you get 7,000 applications and you have 17 slots, what do? That's tragic, real tragic. Please.
Thank you.
Now,
Dr. Vishwanathan.
There are a lot of concerns about graduates who graduated years ago. And some of them could be myth and misconceptions that someone is older, may not work harder, and may not seek supervision, and maybe insubordinate. And as Dr. Kothari really pointed out, that some of them who have done graduate medical education, I think they are more knowledgeable, but at the same time, they may not take orders from the immediate seniors who may be way younger. So there are some issues. But I don't think one can do a broad brush and say the older graduates are lazy and they don't work hard. But unfortunately, all these assumptions are made. And some people, who are not actively engaged in clinical medicine, they may be rusted, they may have forgotten medicines, and they have to relearn medicine all over again. So these are some of the biases people have, and it's quite unfortunate as far as I'm concerned.
Dr. Eng? Thank you,
Yes.
Doctor.
One of the questions I would have is there anything that this body, at least in MSSNY and maybe at the level of the state or AMA, that prevents these filters? Because it's almost, it's an age discrimination somewhat as well. I think our goal in medicine is to find the best qualified candidate to take care of members of your community. And when you start to place these filters, and you see exceptions sometimes being made for perhaps someone who can make a family who makes a larger donation, because you have offshore schools of people who have international medical grads, overseas grads, basically is what we're talking about. They have different abilities and financial statuses, right? Ability to pay. Then you have offshore schools, right? And there's an advantage to them because of the lobbying that happens in the governmental level. And I'm wondering, I've always thought that people who have already been previously trained, they deserve a fifth pathway. We've instituted that in some medical schools, and we recognize that people have been remotely delivered. Can we create another fifth pathway again? I mean, this is obviously not a conversation for today, but it is something to think about, or to consider also creating our own residency. It's a transition. There's nothing that prevents us from going to medically underserved areas and creating residency. It's always about GME money. But if you don't accept GME money, you can do your own residency. You can create your own.
Thank you, Dr. Eng. Yeah, go ahead, Dr. Mehta.
No, I just wanted to say that everything is on table. I am part of the AMA. I have been part of ACP for the IMG task force. For the sake of current discussion, I just want to say that yes, let's move on for this candidate to understand that they have to deal with certain situations, and we are preparing them the best possible way. Thank you.
Right, but perhaps
I do think that
our own.
Yeah,
that we can agree that we should try to do our best to get our hospitals to lift those filters.
I like Dr. Eng. I'm very happy that you brought this up. When we take students into medical school in the US, we actually praise them for non-traditional pathways. It's almost like, oh, you wanted to be a lawyer, but now you want to be a doctor. That's great. You bring different experiences in. Somehow we hold that against candidates when they're applying for residency. I have noticed that in the surgical specialties, the year of graduation may not be as much a negative marker because it's hard. Those are hard to get in. So someone's already a surgeon. They're coming here. They may actually have an upper hand if they have good but in medicine, because of what Dr. Kothari and others have said, the number of application inflation, it has really become a concern. And whether we create another pathway or we create a system where we reduce the number of applications, that would be one way. And then we remove the filters altogether. We've already gotten rid of step one. And the last data that came out, program directors in internal medicine were still focusing on step one scores for international medical graduates as very important. In many other specialties, it was not. Now it's really going to be no option. So we'll see where this goes. I think Dr. Mehta is in the best position to get this message across to different societies. And we talk about not discriminating, but filters is exactly what we're using. Some of the filters are reasonable based on our own mission and vision of the program. If it's a research-oriented program, then you want to create that filter. But these other filters with scores, with age, with year of graduation, they really actually come under the umbrella of DEI. And if we are focusing on diversity, equity, then they really need to be addressed. So thank you, Dr. Mehta, for taking this message. So we're going to end here. I'm going to pass the baton back to Dr. Sahgal. Some of the questions are actually not related to interview, so I have not brought it up. We have your questions. We will answer them similar to the last webinar and post them for you. And thank you so much to all the program directors and physicians here for your time. And thank you for letting me moderate the session. Dr. Sahgal?
Dr. Jamshed, thank you so much. You did such an amazing job. Amazing. Thank you so much. But before we let our esteemed three program directors go, I just want to take a quick round, get their thoughts to see if they have any final thoughts for those 180 attendees out here. So maybe Dr. Kothari, thoughts from you?
Well, this is fantastic. I did not expect this, frankly. This is great. And what you have done is to stimulate me to do a similar program in New Jersey. I already wrote to my fellow governor, we must do this. This is necessary. And maybe more, maybe more.
Yeah. That is wonderful. And we will be very happy to participate if this brings any help.
Oh, definitely. We'll call
Let us know if we can help in any way.
Okay.
Yes.
Because when I look at the international graduates, because I interview them and they come here for their observership, I really feel sad that such a talent is being wasted from all over the world. It's not just here. We are talking about training nurses to do geriatrics, for example. I saw that US Congress wants to train because there are not enough geriatricians. Maybe Dr. Jamshed can say something about that. What about all these kids walking around and driving Ubers? They are physicians like you and me, and they are driving Ubers. That's a shame to the country. There has to be another pathway for them to help healthcare. So I'm sorry, go on.
No, Dr. Kothari, I think one of the things we're struggling with is that we also have many US seniors who are not matching. So I think there's a lot of concern right now and push for CMS to increase the number of residency spots. I'm not sure that will be the complete answer, but it's both IMGs and US seniors who are struggling with this. You go to med school, you do all this stuff, doesn't matter which country, and then you end up not being able to train the way you want to. So increasing residency spots might help. I think Dr. Mehta might correct me if I'm wrong, that they have increasing 1,000 spots over the next 5 years, probably 200 per year. Correct, Dr. Mehta?
Yes.
That is correct. The only addition I like to say that US seniors are not matching because they are very choosy. It's not that there is not availability, but I want dermatology, and if I didn't get, I promoted that I did not get it.
Yes.
So there are 65,000 candidates and 35,000 total positions. One candidate applies more than 100 applications for internal medicine. That is the IMG that came out this year. So yes. But anyway, I'll not divert the discussion.
No, I don't think it's a compare. I think there should be different pathways for each. Now, I'm looking forward to the next seminar about the Plan B and that's really very important for people to understand that, do not be disheartened. I also think we need to decide, is the end for us that we must train in the US, or is the end for us that this is who I want to be as a physician? If you want to be a surgeon, then you want to be a surgeon. But if you want to come to the US, then you can think of different pathways. So I will stop there because I can go on about it.
I see your passion, Dr. Jamshed. That is amazing. But before I pass on to Dr. Vishwanathan, I just want to touch base with Dr. Kothari. Dr. Kothari, you and I share this common line, the thread that how to help these kids from coming out of these Uber and medical assistant or clinical assistant. So about 9 years ago, we launched this primary care pathway for people who could get into residency, where they can become nurse practitioners by doing an accelerated RN and then an NP program, a work study program where they can support their families as well as continue the path. It's an amazing success. Actually, many of the attendees that are in this webinar work for as clinical assistant in SN, and I have seen a few of them actually become going to residency after RN program or even NP program, but more of it to come. Just a few words, Dr. Vishwanathan, thank you so much for joining us. Any parting thoughts from you?
I think the major problem the international medical graduate face there, they need a J1 visa. I think this year we have 50% of our graduates, 50% of our residents, PGY1, they needed J1 visas. There is a lot of paperwork goes into it. And two of those residents could not join on time. And one of them, we had to withdraw the contract because he couldn't get J1 visa. I think in general, international medical graduates overall, they outperform basically the medical students from the Caribbean offshore medical school, but their opportunities are limited mainly because they need J1 visas. I think that is one issue. I think the international medical graduates are interested in joining residency. They should pursue a residency training program soon after graduation. They should not wait. I think if they wait, then they will not qualify as being a recent graduate. And if those international medical doctors are difficulty finding residency, there are alternative pathways. I think many university hospitals give them a J1 visa, what is called a resident scholar. I think that is an alternative pathway because some of the our own residents have gone through this pathway. And if they can get a solid reference letter from the university hospital who can attest to their good work ethics, the initiative and the motivation, it makes it a lot easier for them to get into residency training program. I mean, the other alternative pathway is some of the fellowship training programs. There are not enough applicants. For example, geriatrics medicine, sleep medicine, even nephrology medicines, many of the positions go vacant. The reason I say that some of the applicants to our residency training program, they are already a nephrology resident somewhere, or they are doing geriatrics fellowship in another hospital. I think that pathway makes it a lot easier to get in because they have US experience and they get reference letters from the program director and the faculty who have intimate knowledge of their work ethics, the medical knowledge and the clinical competence. So there are alternative pathways which the international medical graduates should pursue before they can find a residency training program.
That is wonderful advice, Dr. Vishwanathan. And in fact, we in our group we started a non-accredited geriatrics program just to help people get better credential. And I know that SUNY Downstate Nephrology has a lot of IMGs who graduate as fellows, and then they decide whether they can get into residency. But that is wonderful advice. Thank you, Dr. Vasudevan. And finally, Dr. Gunturu, any words of wisdom, final words, advice?
Two things. One is to the all panel and everybody for organizing this thing. Thanks a lot. I think this is very helpful for the IMGs. One plea would be behavioral health or psychiatry is so much understaffed in so many areas. So when you're creating any alternate pathways, I would definitely plea for keeping behavioral health or psychiatry in the loop, as it is the expertise is so scarce. And every day morning from the time we wake up, there is always staffing issues. And the mental health physician shortage area, which is MIPSA scoring, is the highest in South Bronx. And we still don't have enough psychiatric workforce. So when one plea for the leadership would be, when you're thinking about alternate pathways or creating pathways, so definitely think about behavioral health. For the applicants, for the interview point of view, when you are in this whole residency struggle, or when you're in this path of trying to get into residency, it might feel like the biggest thing or a biggest hurdle in your life. But once you pass through it, and when you look back, it always looks like a small blip in your whole career. So problems always seem much bigger when you are in it, and you can always connect the dots only backward. And everybody who is in this panel, if we were able, we all are IMGs, and if we are able to do it, I'm pretty sure that you all can do it. With that, that's it from my side.
Thank you, Dr. Guru. Amazing. Thank you. And finally, to Dr. Parag Mehta, without whose leadership these seminars would not be possible. Dr. Mehta, any words from you?
Again, I hate to correct you, but this is possible. First is because of the participants, and second is because of the great panel speakers. So I choose something to do. I have a desire, I have an ambition, and then you make it fulfilled. So thank you, all the speakers. Thank you, staff of MSSNY, ethnic societies, and the participants. I was a silent listener. I just want to give few of the other information. That's the reason I chose to listen to everything. Regarding the visa, the AMA IMG section had called lawyers and had done few seminars. If there's really need, we will bring another seminar to the lawyers, how to get J1, how to get O or any kind of, H1, H1B and other visas. So we can have a separate session. I thought that the most useful will be how to get into the interview. The second portion, which was discussed, that alternative pathway, we will definitely do after the match. So I want everyone here on this call to match. But in case for somebody who doesn't match, there are many, many alternate pathways. As Jeet was saying, there are the informatics, there are MPS, there are MBAs, and goes on. Many, many more things we can do together. But just send your concerns, your questions. We will work through AMA, through ACP National, as well as through the medical society. We are here to help you because we have not forgotten our days and the rules. Where we are, you should be there in very soon, and we hope the best of luck to all of you. And thank you, Sumir, for such a wonderful, controlling everything as well as bringing us to the right place. So thank you, Sandy. Thank you, Michael. Without two of you, it would not be possible. And all the participants, best of luck. Thank you.
Dr. Mehta, thank you. And I second thank you to Sandy, Michael, and Raquel for taking so much time or helping our organizers. Special thank to our speakers from the Ethnic Medical Association. Special thank you to Dr. Barmecha, Imelda, and Sebas. And an amazing, heartfelt thank you to our program directors, Dr. Vasudevan, Dr. Kothari, and Dr. Gunturu. Thank you again. And thank you, attendees, for joining us. Hope it was useful. And feel free to put on more questions. We will summarize it. We will have it up and running in the MSSNY. Don't forget to go and visit the best personal statement also on the website. And have a wonderful rest of the Sunday, and best of luck to everybody. Take care. Thank you, everybody. Logging out.
Thank
Appreciate it.
Thank you, everyone.
Thank you.
Good luck.
Thank you.